tonight. Thank you for supporting the show. We're going to start with, hello, my name is Dr. Timaree, and I'm going to talk to you about the economic argument for why you should support comprehensive sex ed and making it as easy and affordable, if not free, for people to access sexual health care. So I became a sexuality educator because I believe that bodily autonomy is pretty central to personal liberty and to social justice. I think that you should be able to decide what you do with your body. I think you should decide what medical procedures you have done, when you have sex, with whom you have sex, and when you have kids, if you have kids. Now, we also know that people being able to make these informed choices for themselves have really positive outcomes. If you're able to decide this stuff for yourself, your physical and mental well-being, much higher. You're much more likely to meet your goals in terms of education and career. And generally, your sense of well-being is higher. But let's just imagine you fucking suck and you don't care about it. And you don't care if they are happy and healthy and living their best lives. Let's say the only thing you care about is how much you're paying in taxes, how your stocks are doing, and how the economy is. Let's just imagine. So even if that's the case, you still should support these things. So, hormonal birth control. It's prescribed for a lot of reasons besides preventing pregnancy, but it's really good at preventing pregnancy. And if you want to prevent pregnancy, it's really important that you have access to things that'll do that, because if you get pregnant when you're not ready for it, that's really traumatic for the body. It's extremely expensive, and there's a lot of ripple effects. 1/3 of people that drop out of high school attribute it to becoming a parent. And we need to give people the agency to decide these things. So if you become pregnant and you're not ready for that, you should be able to access abortion care. Because if you're able to access abortion care, you're 6 times more likely to be able to achieve your goals in terms of educational attainment, in terms of career, in terms of being employed in general. Conversely, if you are not prepared to have a kid and then you have one, we will have a cascading effect of costs that happen from that. And so in states that ban abortion, they cost the US taxpayers $68 billion annually.
Ooh.
So it makes a lot of sense for us to support this. And in addition to that, we're not just talking about the individuals involved, we're talking about population health. Because if I am not ready for a kid, that's gonna impact my life, but it's also gonna mean the kid gets fewer resources. We're talking about lower birth rate. We're talking about health issues for those children. And this becomes a generational problem. We have generations of people who are impacted by this lack of information, this lack of resources. And when we look at countries that prioritize sexual health care, we see that not only do they have a higher GDP, but they also have higher rates of productivity. So, for instance, every additional birth that a woman has, we find that they lose about 2 years in the workforce. Now, you may or may not give a shit about that, but that is a person who is down to work, but not necessarily able to. That's a person who's not making money and then not spending that money. That is a person who's not necessarily being taxed on that money, right? So if you don't give a shit about her, maybe you care about that. There's a lot of other factors aside from having kids. Another thing that can happen when you have sex is you can get an STI. Most STIs, preventable. Most of them are treatable if not curable. But if you don't know how to prevent them, and you don't know what your status is, it can become a really serious problem. It can come from a very small infection to a serious chronic medical problem. It can mean that you miss work a lot. It can mean that you lose your job. It can mean that you have serious lifelong consequences. And it also means that if you don't know you have it, you might be spreading it to other people. And so it becomes no longer just a you problem, it becomes a population health issue once again. Additionally, we want to care about consent and preventing sexual assault because, well, in this room, we're good people. But again, let's say you don't care about that and you just care about bottom line. It's actually really expensive to have a culture that normalizes discrimination and harassment. If you have a company, for instance, that normalizes those things, your best and brightest are going to fucking leave. And if you get sued, kind of expensive. In the rare instances where somebody is actually criminally charged and faces consequences for sexual assault, it's incredibly stupidly expensive to imprison people. It's like the worst possible use of money that we have. So we definitely want to avoid that outcome. All right, so just going back over this again. All right, so we can put a little bit of money up front in education, in making it easier for people to access sexual health care. And what we know is that that will lead to them having better life outcomes. They're more likely to do the things they want to do. They're more likely to be invested in their community. Their babies are healthier, and this goes forward generation after generation. Conversely, we don't put this money up front. You know what happens? We got to pay the bill later, and it's exponentially higher. So aside from the fact it's going to cost more later, it is to your benefit to live in a society full of people who are physically healthy, who are invested in their community, who they are stable, versus people who are uneducated, physically unhealthy, and desperate. So for that reason, we're going to support comprehensive sex education and easy access to sexual health care. Thank you so much.